Well, good afternoon. I'm Scott McMeans with the Donoff Companies, and I'm a Chamber of Manitowoc County board member, and I'd like to welcome you today to our webinar, COVID Conundrums, How and What to Prepare for COVID if it's traced to your business. The Chamber proudly serves its membership in the community through these free educational seminars paid through the membership dollars. If your business is currently not a member, please consider looking into a membership to enjoy the other benefits that go with the Chamber membership. Today we have over 80 people registered for our webinar. So I'd ask if everybody could please take a moment to check their phones or their computers or devices and make sure that you're on mute during the conference. At the end, we'll be taking some questions which could be asked by entering the questions on the Q&A part of the Zoom. We'll attempt to capture also some questions from Facebook Live. Please note though, with the questions, we will not be able to answer any COVID legal topics today, so we'd advise you to speak to your legal consultant on any topics that you might want to discuss around legal COVID issues. So today our featured speaker is Lexi Otis. So Lexi earned her degree in health promotion through the University of Iowa, which was then followed by 2 years of time in the Peace Corps in West Africa. So Lexi moved to Wisconsin 2 years ago, where she is currently serving as a health educator with the Manitowoc County Health Department. And so with that, Lexi, welcome.
Good afternoon, everybody. Like Scott said, we have a lot of people who did register. So I tried to compile all of the information I thought was going to be relevant for businesses, starting with more of just the general questions I get about COVID itself, and then moving into more of the business specific topics. But we did try to leave quite a bit of time for questions, so we're hoping to have about 20 minutes minimum, maybe more for questions. So if you have them, like he said, enter them into the chat. Someone will, kind of go through them, see if they've already been answered, and hopefully we can get to all of them. Otherwise, my information's at the end, and you can always contact me yourself. So I'm going to try to share my screen here. And I did put together, for those of you who have the webcam access, I'm going to try to put up my PowerPoint here. If not, I'm going to try to over-explain all the processes, because with COVID, it's a caveat system of there are general recommendations, but that sometimes one size does not fit all. So, Scott, does everything look good on your end? Okay. All right. So just about the general process of COVID, when anybody decides to go get tested, they just go to one of our community testing sites, which we'll talk about, or see their provider. And then that provider is going to be the one doing the notification. We get calls a lot from individuals or businesses seeking, results. And we're not the ones who ordered the test. We don't do testing at the health department. We are not doctors. So that goes through the actual provider. And then the provider will call the individual and let them know if their result's positive. Due to time constraints, a lot of providers are not calling with every negative test like they used to back in March and April. A lot of them have set up electronic formats to give results. So like Prevea has an app that you can then download and go look at it and look at your results, and you'll see right when it's in. But with any positive case, that provider will call the individual, and then they call the health department. It's reportable to us, along with a plethora of other diseases, tuberculosis, STDs, hepatitis, HIV. So the health department being involved in communicable diseases and doing follow-up and quarantine, all that is nothing new to us. The only thing new here is the actual virus itself and learning how it works and time frames and infectious periods. So the general processes are the same that the health department kind of always takes care of. So once we get the call, we have an electronic system. We'll be able to see all the results of everybody who's been tested. And so once we get that on our end, we'll make a call to the individual. Sometimes it's about 30 minutes to an hour after they've gotten it themselves. So there could be a delay. We've gotten calls from businesses before that said, hey, my employee just told me that they're positive. What do I do? I get the name and I'm like, I don't even know who this person is yet. So we haven't even had a chance to talk to them for me to know if I have permission to talk to you. So we will reach out as we are able to. You could certainly make a courtesy call to us if you have a situation, but like I said, sometimes there is that delay and when we can get to a person versus when a person knows, and a text message is a lot faster than what we can do on our end. So then we call that person, and some of these things I'll just cover briefly in the next slide, but we're going to be looking at that person's infectious period and then who their close contacts are during that infectious period. So we'll put that person under isolation who is positive, and I'll explain that in a second. We'll look at their contacts, and then we'll quarantine those close contacts during the infectious period. So our interview with the positive case can take an hour, hour and a half, depending on where they've been and how many people they've been in contact with. So we really try to do a super thorough job to figure out, just because that person was the first one identified, especially with workplaces, just because they were the first one identified does not mean they were the one that brought it in. They could have easily gotten it from someone who was there who maybe doesn't know they're sick, or out in the community. So again, we have to do our due diligence of looking at where did they might get it from, and go from there. So one of the big questions I get is, who do I need to send home? Who's under quarantine? What is a close contact? So right now, and things change all the time, but this is what this has been for a couple months now. A close contact is someone who is within 6 feet of that positive individual for at least 15 minutes, and that's cumulative throughout a 24-hour period. So you talked to Jan 5 minutes at lunch, and then you went into her office to ask her a question, and you were standing next to each other, and then later that day you were talking about what you're going to do tonight. If that adds up to more than 15 minutes, then Jan needs to be a close contact and should be on quarantine. If you have direct physical contact with that positive, so maybe you drop groceries off to grandma and grandpa, you go inside, quick second, give them a hug, tell them you miss them, and you leave, and grandma and grandpa come out positive, or start getting sick and then get later tested and are positive. If you fall within that infectious period, that hug is going to make you a close contact, that direct physical contact, handshake, hugs, kisses. So it's really important to maintain that physical distance always. And then the other thing would be coming in contact with someone's respiratory secretion. So someone who tested positive, who maybe you were standing right next to when they started sneezing or coughing, and you're like, oh, are you okay? Because the respiratory secretions are coming out at a higher rate during that time, you're going to be considered a close contact. Same with sharing food, beverages, utensils, some personal items where that saliva swap is more likely to happen, then you're a close contact. And then also people who spend the night. So usually household contacts, but also if, like, let's say you have a kid who then the kid's sick and he had just had a sleepover, then they're all going to be close contacts. So the infectious period that we're looking at to know if someone's a close contact is 2 days before symptoms start. So I wake up on Monday, I have a headache, don't think anything of it. I'm tough, I can make it. I go to work on Tuesday, my headache's still here. Wednesday, wake up, and now I just feel really tired. I feel off, and I call in and I said, hey, I'm not feeling good. I'm just gonna go get tested to see, maybe I got tested Wednesday, Thursday and Friday goes by, now it's Saturday. And I get my result and it's positive. We're looking at 2 days before the earliest symptoms. So we talked to that person. He said, oh, I started with the headache on Monday. Well, now we're looking at the previous Saturday and the previous Friday as the infectious period, and all those close contacts from the time that person went home on Wednesday, that's who we're looking at. So if someone has symptoms, they need to go home immediately, because the longer that you are out and about with symptoms, the more and more close contacts you're going to have. So it's very important for symptomatic people to go home and be by themselves. The more days you have, the more contacts you have, the more of your staff, the more of your coworkers are going to be sent home. There are people who are totally asymptomatic, no idea they're sick. They go get tested for one reason or not. Maybe they were a close contact but never experienced any symptoms. Then in that case, because there is no symptom onset, we use the collection date. So not the result date, but the collection date, and go 2 days prior to that too. So if I was tested on Wednesday, then the health department's gonna call and say, all right, what did you do on Monday? What did you do on Tuesday? And then the positive case is the one who gives us those close contacts. So sometimes we get a call from people saying, hey, I heard this person's positive, I was with them. If they were not listed as a close contact, there is nothing that we can do about it. We are not following these people. We don't know where, individuals were. We don't know what they're doing in life. So we have to go by their word. So we always suggest, if someone calls you and says, if one of your employees calls and says, hey, I think I'm a close contact, ask them, did the health department reach out to you and tell you need to quarantine? If not, and they're like, no, I know I meet the definition, I looked it up, they need to call that positive person and say, did you give my name as a close contact? Remember, we were together and we did this. Positive case can always call us back and say, hey, I forgot to mention, I went and got my hair cut, and my hairdresser is close contact. We were physically, obviously, touching. Happens all the time. It's very hard for people to remember 24 hours a day, every day, where they were and who they were in contact with. So close contacts we get from the positive case, and that's who we include. And it is possible that some people are forgotten. It's only as accurate as the information that we're given, and we can all only do the best that we can do. So then we talk about quarantine and isolation, and this gets pretty confusing for people. So quarantine is for well individuals, usually just contacts. Isolation is for sick individuals. Those are the positive cases. So if someone is under quarantine, quarantine is 14 days from last exposure, not from when they were notified they were a contact. So again, let's say, that person who was at work Monday and Tuesday, went and got tested on Wednesday, found out on Saturday. If they had a contact from work on Monday, then that person is already halfway almost done with their quarantine. So everybody completes a different portion of that 14 days. And I get calls all the time from employees who say, hey, this person at my work, they were a close contact and they've only been gone for 6 days and now they're back. Well, it could be that they were one of those late notifications. I can't confirm that they were a close contact or that anybody was positive unless I have permission, but I do go through the general guidance and say, here's scenarios that could be happening. So again, everybody completes a different portion of those 14 days. So it's from last exposure with the positive case during their infectious period. The thing that changes is a household contact. So someone who lives in the household, if they cannot completely separate in the household 100%, and actually last night at 9 p.m. they just put out new guidance of what total separation means. We actually have new guidance today, but typically it means that you can't share any common spaces. You have to sleep in a different area, eat in a different area, live in a different area. Those people then, their last exposure day, if they're with them every day, that 14-day restarts every single day. I'm with them Monday, start my 14 days. Oh, it's Tuesday now, I'm still with them, new 14 days. So they actually go 14 days after the person in the household is considered well. So once that person is off of isolation who is positive, they're good to go, they're cleared by the health department, then the people start their 14 days. And the reason that it's 14 days is because once somebody's exposed to the virus, that virus then enters the body and it's going to start to replicate. And that replication process is not a speedy one. It can take up to 14 days for the virus to really be in the body, work its way, and actually make someone sick. So we've had numerous times people day 13 of their quarantine is when they started getting symptoms, went on their day 14 to go get tested, had to wait for their results, and actually came out positive. So people do the 14 days. Going and getting a test in the middle of it is, I mean, it's good knowledge to know, are you positive or not, so you can start contact tracing sooner, but it's not going to negate the fact that they need to finish that 14 days. If you are negative on day 7, that's amazing. But what is day 10, 11, 12, 13, 14 going to look like? Because we know that's the tail end of when people will develop symptoms. CDC has kind of found that after 14 days, the likelihood of someone developing it from that exposure is pretty low. So it's not 100% guarantee, but that's kind of what they're seeing is after 14 days, it's very low that exposure would cause someone to be sick longer than that. So as long as someone remains asymptomatic those whole 14 days or whatever portion of those 14 days that they had to complete, even without a test, then they're released from for the health department standards. It is recommended that everybody get tested, but I'll talk about that in a second. So now to the positive person who's on isolation, they're sick. Those 14, that 2 to 14 days that it takes for that virus has already passed. They already had their symptoms, or maybe not, but they're positive. So those 14 days already passed. They didn't even know it. So their isolation period is 10 days from symptom onset. So again, going back to that person who had symptoms Monday and Tuesday, got tested Wednesday, found out on Saturday. Well, when you find out on Saturday and we look at your symptom onset, we say 10 days from that. Well, it's already been 6 days. So now they only have 4 more days of isolation. And that's as long as the second and third part of isolation is the positive case has to be fever-free for at least 24 hours, and that's without medication, so no ibuprofen or Advil to bring that fever down. Not a lot of people recently have been having fevers. In the beginning, it was more common, so you do not have to have a fever to be sick. It's a good symptom that you can measure very easily with a thermometer, which is kind of why it's put out there so much, is because I can actually measure that. I might not be able to measure someone's headache level, but I can measure a temperature. And then the other portion is they have to have symptom improvement. So the health department, they symptom monitor all of our people on quarantine and isolation to know when they're released and when they're not. Because we have to, keep tabs and make sure that everybody, before we can declare them cleared, that's actually true. So they do 10 days. Again, studies have shown that after 10 days, people are not usually infectious to the point that if they come in contact to someone, that then they'll develop it. So the 14 days is how long it can take to actually develop. The 10 days is after the development. You're kind of infectious for 10 is the tail end. Doesn't mean you can't be infectious on day 11. No, but like I said, everybody's kind of like, that's the main criteria that they're seeing in their studies. So a negative test does not typically release someone from isolation early, just like it doesn't for quarantine. For quarantine, it's more set that that's true. For isolation, they're coming out with new guidance saying that there might be a way that if you get a certain number of tests within a certain number of times, that then you could be released early. It takes a couple days for results, so typically it only gets you out a day, maybe 2 days early, and that's if you can find a provider who will test that many times. There is slightly a shortage in tests, more so recently than in the past. So to find someone to test those people over and over just to get out of isolation a couple days early is going to be kind of hard. So there is that caveat in there, but it's not typically used. So I took this from the CDC just as a visual. So again, this is a standard quarantine. So that red circle really is when the person was supposed to start their home isolation. That was the date of their last contact. Date of last contact, we count as day 0, and then we count to 14, and then that would be their last day of quarantine. So someone who is exposed on the 1st, their last day is the 15th, and they need to complete that last day. They have to complete day 14 and they're released then that next day, day 15, is when they're able to go back in the community. We provide documentation for the people on our caseload. So if they got called by us and said you need to quarantine and we're symptom monitoring them, we provide them with the information on when they're good to go. We will send them an email that they can send to whoever they want to prove that they are good to go. We get calls sometimes from people who say, hey, this person tested positive. I was a contact of them. I've been staying home for 2 weeks now. My employer wants a letter. And they have nothing to do with us. They were not actually a close contact by health department definition, but their workplace decided we're just going to send them home anyway. We cannot provide documentation for people who we did not say they need to quarantine. So if a workplace decides to go stricter than what we do, which again, kind of we'll get to in the more the business portion, then that is fine, but we can't provide documentation saying that they needed to quarantine when we didn't tell them that. So this is the criteria for a household, again. So that gray section is when that person was sick. And then once they get to the end of their home isolation, once they get that well date, then that 14 days starts, and that's for people who can't separate in the household. So that's how that looks. So it does keep people out for quite a while when they can't separate. So just know that that could be a situation that your employees get to, and it takes a little bit of time. So testing, if someone has symptoms, they should just go get tested right away. If they don't have any symptoms, if they are contact and they are asymptomatic, again, they don't get out of that quarantine early. And the science is kind of showing that because it takes anywhere from 2 to 14 days, people who get tested immediately after finding out they're contact, they're most likely going to come back negative. It is too soon. So we typically tell people to wait 7 to 10 days after exposure to get a more accurate picture of, are you truly an asymptomatic carrier? Because day 2 and 3 after exposure, the odds are that you're going to come out positive is very slim. The process usually does not take that long, with the average being kind of like 6 to 7 days is kind of what they're seeing. So if with symptoms, go get tested. If you don't have symptoms with an exposure, wait that till the end of that 2nd week of the quarantine. Oh, do you want to go back? And then, so I just wanted to kind of touch on where I get these calls all the time. I want my employees to get tested. Where can I? Family over by Walmart is testing. They are doing symptomatic individuals and asymptomatic contacts. So if someone doesn't have symptoms, but they were a contact by public health, then they can go get tested there, no problems. Aurora is testing only symptomatic individuals. If you are an asymptomatic contact, you're going to have to go to Green Bay to their community testing site. They moved that a couple weeks ago. We did have it here in Two Rivers, but for them to kind of bring supplies to one area, they now only have that community site in Green Bay and Milwaukee. And then Prevea, same thing as Holy Family, symptomatic individuals and asymptomatic contacts, no problem. We do have Lakeshore Community Healthcare, a federally qualified care system over on Calumet Avenue. They're also testing. However, they're only testing their clients that are currently established with them, and then they'll look at individuals who don't have any insurance. So COVID testing for these reasons, for symptoms and like exposures, should always be free. You don't need to have insurance. However, that's kind of the clientele that they serve. So that's why it says individuals without insurance. If someone without insurance went to Holy Family, they still would not have to pay in this situation. But that is their specific clientele. The DHS does have a website that has a community map, and it's interactive and shows the number. And so if someone lives closer to Sheboygan or someone lives closer to Brown County, they can pull up that map and see where they can get tested. They don't have to go in Manitowoc. Their results will go to where they live regardless of where they're tested. So I know we're it's like already halfway, so I'm going to try to rush through this. So when should an employee return to work? Big question I always get. So in general, we would like businesses to follow our recommendations of close contacts, go home those 14 days. That's just what it is. positive individuals, they're home the 10 days as long as they have that 24 hours and the symptom improvement. So until the health department clears them, those two are kind of our like clear-cut ones. So if someone at work is just sick and has no known exposures, send them home, ask them to get tested. Anybody with symptoms should get tested. If they don't want to get tested, that's fine if they don't, the safest route is to assume it's COVID until proven otherwise. There are absolutely other, illnesses, viruses out there. It might not be, but again, the amount of risk you want to take knowing how this actually spreads in a workplace, it can be pretty easy. You might just want to be safer than sorry. So if someone says, I'm not going to go get tested, we recommend you keep them out the 10 days since their symptoms started, since you sent them home. Assume it's COVID until you can be proven otherwise. If they can go see a doctor and the doctor says, nope, it's not COVID, they're good to go. Great. So this picture that you're seeing is a decision tree we just made for schools. I am going to work on updating it to be business related. So some of the things will kind of be different. Like you won't need to call a parent or guardian to come pick them up and put them in an isolation room. So we do have that guidance out there. If someone is sick and then when you talk to them, they're like, yeah, my wife was in contact with people who were exposed, but I wasn't, then get them tested. They're not necessarily a close contact, but that risk increases with the more and more, things you find out about that person. So it's kind of a case-by-case basis. If a person is positive, when can they return to work? Do they need to have a negative test? And our answer is no. The CDC took back their recommendation that before they had a couple different recommendations for return to work, and one of them was have them have a negative test. They've since retracted that and said that's not a good method. And the reason is that people who are positive typically test positive for a very long time because the PCR test that they do is so sensitive. It can find that virus even when there's very little in the body. And they've found that positive people can test up to 12 weeks after they were diagnosed positive. If you're going to keep them out for 3 months, they're only infectious for about 10 days. You're keeping people off of work who don't need to be off of work. So truly, once they're considered no longer infectious, they met that criteria to be off of isolation. That's what we say. That's when you can bring people back to work. We do not recommend having them have a negative test before they can return to work because you're just going to keep them out for a very long time. And again, a lot of providers aren't going to test people who are already positive. It's when there's a shortage, that's just not the priority population who they're going to use a swab on. So outbreaks, I put the definition. It's on the state website. I highly encourage everybody to go look at it. An outbreak in a workplace, if it's not a skilled facility like a nursing home, is 2 cases within 28 days of each other. And we only include the ones who are at work during their infectious period. If you have an employee who worked while they were infectious, then we're going to track that on our end saying, okay, we have kind of like a watch list. Let's watch this facility, see if there's going to be a second one. We determine their 28 days from the last facility exposure. And then if at the end of the 28 days, there's not another one, goes away. If you get a different one down the road, watch list again. If you have 2 within 28 days and we can see some sort of link, your workplace is going to be considered an outbreak. And I think that word scares people. I think that it's a very bold word when you're talking about 2 cases. In a smaller facility, that might mean a whole lot if you only have 5 employees and 2 of them are positive. In a large facility, it might not mean as much. So that's why it's not an automatic closure of a business. You do not have to close if there's an outbreak. We get that question all the time. You need to look at your facility. What do you want to be your criteria for closing? We'll have conversations with, businesses. We work one-on-one on what's the best option. But just so you know, an outbreak really just kind of opens up resources. People will test asymptomatic individuals who aren't contacts if they're part of an outbreak. So those individuals wouldn't have been able to be tested if it wasn't an outbreak. And what it does here, this picture on the right, it's a number. So they only list names of actual skilled nursing homes, so like, or skilled facilities like nursing homes. Businesses, it's just a number on a category. So that's what an outbreak is, and the outbreak is over if 28 days has passed since the last facility exposure and there was nobody. So, first case, you're counting your 28 days, which is 2 infectious periods of coronavirus, because that's 14 days, or 2 incubation periods, sorry. So from the time that the virus could develop. So 2 incubation periods pass, you have a second one, you're an outbreak, you have to wait till 2 incubation periods pass to be closed. And you can have multiple outbreaks. So we track that on our end. We'll let your facility know, talk about what are the next steps. Do we need to look at, is it spreading? Were these linked to something else? Were they maybe at a wedding where we know that there was 20 other positives? So we're gonna say they most likely got it from that and not work. And again, they have to be there during that infectious period. So if you can keep people out who have symptoms, that's gonna help you from not becoming an outbreak. And then business plans. I think it's super important to have things written down so you can follow them and be consistent. Most people have plans of, how are we gonna rearrange, or how are we going to, work our facility or our staffing schedule? Are we gonna have people working from home? Things that people often forget from the calls that I get is, again, letting their employees know what they need to do before they return. I get employees that call me all the time and say, my workplace sent me home, like, how do I go back? And I'm like, you got to call your workplace. Everybody's making their own decisions. And what kind of documentation do you need? Again, we'll provide documentation for our people, but if a business decides, we know the health department's taking care of the close contacts, but this positive person worked on a shift with 20 people, just to be extra safe, we're going to send those 20 people home. What kind of documentation do you need for that? How are you tracking those employees that aren't a part of our public health investigation? So you can go as strict as you need to do for your facility. If you have a vulnerable population, it might be something that you do want to be extra diligent about. If it's like a large factory where you can't operate if you send more and more people home, then you kind of have to look at your facility, and that's why there's no cut and blank or cut and paste business plan for pandemics, because one's not going to fit with another. So definitely sit down and think about those things. Communication is huge. People get very upset if they hear a rumor and haven't been addressed it. And not saying it's a business's necessarily responsibility to address rumors, but I think the more clear communication you can have, the better off that it's going to be. We've seen some businesses just get torn apart about false information. So, I definitely think when you're planning, when are we going to communicate? To who are we going to communicate? Is it just to our staff? Are we just going to talk to close contacts? Are we going to talk to the public and let them know? Are we going to do it if there was facility exposure? Because sometimes you have an employee who was on vacation, they come back, they got sick over that, had no facility exposure. Well, now they're positive. Do we let the public know that, hey, we did have an employee, there was no facility exposure, here's what we're doing here to keep our workers safe? So think about your messages to who and when, because again, the more communication you can give, if you let your employees know, hey, we're only going to tell you about people who possibly could have infected the facility, then they know if they hear a rumor out in the community and my business didn't communicate with me, it must have had nothing to do with the facility. It must have been an outside source. So think about those things now. And then travel policy, big one. COVID's kind of everywhere. So right now, the CDC kind of recommends looking at that on a case-by-case basis of what did that employee do while they were on vacation. So rather than saying that, if you go to Minnesota, that's any worse than if you're just here in Manitowoc and Wisconsin, because there's COVID at both places and it only takes that one wrong person that you're in contact with. It's more of a, when they were on vacation, were they at group gatherings, which we know cause, massive amounts of spread? Were they at a tourist attraction like Disney World, where there might be a lot of people? And then in those cases, maybe keep them home. But for just someone who's like, I went on a camping trip, to this place in Montana, why is Montana any different than Wisconsin? COVID's there, COVID's here. So that's kind of where the travel guidance is lying. Okay, so there's 20 minutes for questions. I know Scott's going to help me field some. Shannon was kind enough to put together a survey of questions. I'm sorry, there was so much information so fast. So if I didn't touch on something and we don't get to your question, I'm very sorry. It's a lot of information in a very short time. It's not the way I like to present. I don't like to just keep talking the whole time. But with a topic that's so broad and so many caveats, there is just so much information to jam in. So I'm going to go through the questions that were submitted ahead of time, and then Scott will field the rest. So if an employee tests positive for COVID-19, do employers have to file a workman's comp report? Not my area of expertise. So for that question, whoever submitted it, definitely consult with your HR or legal department. Really here we just kind of deal with what is the disease, the infectious period, and quarantine and isolation. All that, actual business portions are going to have to go through someone who actually knows something about that and what's out there. If wearing a mask does not negate the need for social distancing of 6 feet, oh, my screen's in the way of the rest of it, particularly in workplaces, what is being done to communicate to people that the mask doesn't matter even if you were within 6 feet for 15 minutes? So yeah, if you're wearing a face mask, unless you have full PPE, you have mask, shielder, goggles, gown, gloves, the whole 9 yards, a mask is not going to get you out of quarantine. But what will is staying that 6 feet apart. If you are more than 6 feet apart from someone, that's what's going to keep your infrastructure in place. That social distance is so important. The mask is super helpful because if a person is sick and they don't know it and they're wearing a mask, normally without the mask, they might maybe release 30, saliva particles out into the air. And with the mask, it captures some of them. And now there's only 10 that are coming out of that mask. That means that there are less particles in the air for everybody else to breathe in. But that mask, a just normal cloth face covering, it's not a medical grade filtering mask. And the N95 is called 95 because it filters 95% of the particles that are in the air. A cloth mask, that's not what it was necessarily made for. It's not filtering. So if something's in the air, there's no evidence to show that you can't breathe that in because that mask is going to filter that particle out. So you still have to quarantine, even if both of you are wearing a face mask, if you're within that 6 feet. So we do really stress that to everybody that we have conversations with. We've posted messages on the media. We've talked about that on Facebook a lot. It's on our website. Travis, who is our emergency services director, talks about it on the radio over and over and over because people think, okay, well, if I still have to quarantine, then I'm just not going to wear a mask. Well, wearing one and everyone wearing one will prevent somebody from being sick that might have to then quarantine people. So it kind of stops the whole possibility. Nothing's 100% foolproof, but the more people who are doing it, the less, chance there's going to be. We've had several scenarios where people went to a community testing site, to a community testing place, registered, then voluntarily left the long line, and therefore never received a test, but received a positive COVID test result in the mail. Why are false results being sent to non-tested individuals? How do we know what's actually valid and what is not? I don't know where that's happening, so I can tell you for Manitowoc County, we do not mail results at all, ever. If we can't get a hold of a positive person, like their phone number is not working and we've exhausted all options, but we have their address, we will send them a letter saying, hey, the health department's trying to get a hold of you, please call us back. It's, time sensitive, urgent, whatever, but we would never mail a result. So I'm not sure where that's happening. But that's interesting because that should not be happening. we've only ever had one community testing site with the National Guard, which is where that long lines are coming from. All of our community testing sites right now, so again, that Prevea and Holy Family and Aurora, they are all appointment based. You can't just drive up. So everybody has an appointment, and I think the wait time's like 5 minutes. And I've heard that from almost all of our contacts. Nobody said that they've waited a really long time. So hopefully this was not a Manitowoc instance, because then I would assume it's a rumor, because yeah, we can't mail positive results without the person's permission. So the only situation I could see that happening is if someone requested their result and it got sent to the wrong place, but because of the sensitive nature, we usually triple and quadruple check that. So I'm not sure where that's happening. Since 8/1/2020 state mask mandate, has Wisconsin COVID cases decreased like projected to do so? I think that's a question that everybody wants to know, and I think that's a really hard thing to measure, is the mask alone, what's doing it? And I don't know that we have that answer, but I can tell you that compliance is a huge issue. The number of large group gatherings that are happening without masks involved whatsoever is still shocking. We get calls all the time. We talk to positive cases who were like, yeah, no, nobody was wearing a mask. Not saying that if they did wear a mask, they wouldn't have gotten sick, but the chance obviously reduces. So I don't know that I can specifically answer that question, but I can tell you that compliance is a whole different issue when it comes to the mask mandate. And I know that if I stop buying gasoline for my car, I'm going to save money. But am I going to stop driving and go and start using a bike? Probably not. So, we know things can happen. The problem is getting everybody to be on board to actually make it happen. So the last 3 I had ahead of time, and then we'll spend the last 15 on everybody else's questions. I've heard some manufacturing companies do not require masks to be worn due to the temperature in their production facility, and that wearing a mask could create a safety hazard due to factory temps. Is there a specific air temperature that has been published that would not require production workers to wear a mask? I have not specifically seen a temperature that says if the air is above this degree, then you don't have to wear a mask. The mask mandate does mention different areas in which, if it's going to be a risk to wear them, that it's, covered in an exemption, but it did not, specify a specific number. That doesn't mean that there's not a number out there from maybe a different, agency that's giving guidance, but there's not one that I've specifically seen. So I think it's got to be a judgment call, but I wouldn't use that as an excuse for everyone to not wear a mask and just try to cover yourself under that. Because again, the less people who are wearing masks, the more chance that there's going to be a positive case who doesn't know they're infectious, and more employees will be off. And do you have the infrastructure in place to keep your operation going if you have, 5, 6 people plus the positive out? We have an employee that will be returning from Mexico next week. What is the recommended return to work procedure? I think I covered that. So talk to your employee about, do they have any known exposures when they were over there? Did, their family members say, oh yeah, I'm a contact to a positive case? Yeah, I got called the other day. I don't know what, Mexico's procedures are and how they're working that, but definitely talk to the person about, do they have other factors other than just being in Mexico? Because then again, I think I covered that. If a student at school is sent home due to the possibility due to possible COVID-19 symptoms, and that student is not able to return to school until they are tested, will the symptomatic student's household members need to leave school? So it kind of depends, and again, this is where people can consult with the health department. If you just have someone who's symptomatic and they get sent home and they're going to get tested, you don't know what it is. So, again, that sick person, you would assume it's COVID until proven otherwise. If it's positive, obviously the family gets involved. Typically, the family would not have to be out if there was like siblings in a different school. However, again, talk to that family. Was there maybe that a week ago they went to a barbecue and someone there tested positive, and maybe they weren't necessarily a close contact, but they do know that they were there with that positive case during their infectious period but stayed more than 6 feet apart, then in that case you might want to be extra cautious and just keep the family home who was at that barbecue. Because again, those close contacts, that time frame, they're all the best recommendation we have, but is that going to encompass 100% of everything? Probably not. So I think those were the questions that I had ahead of time, and I just wanted to address those. So I think the remaining like 12 minutes, Scott, if you want to field any questions we've gotten.
And just as a reminder, if you have a question, you can enter that question on the bottom of the Zoom. There's a Q&A area, so go ahead and enter your question there. We'll try to answer it. We do have a couple questions as well that were submitted. So this one was about children in physical education wearing face coverings. Is that required if they can stay 6 feet apart? And maybe expanding upon that, what about anybody exercising?
Yeah, you know, it's so hard because, you know, the mask mandate is there, but it's very broad and it gives all these caveats. So again, we kind of respect people's decision to look at, you know, what would get me out of wearing a mask in certain situations and not like abusing those caveats. So, you know, we would like people to mask as much as possible. There are situations in which it's not recommended. You know, if there's going to be a lot of sweating involved where that mask would get wet, we don't want that. But if you're going to work so hard all day with kids to wear a mask, then, you know, we want you to keep that up as much as possible. So it gets very, very tough. And again, it's not 100%. Some people can't even wear masks, and again, everybody's just doing the best they can. If someone can't wear a mask for a medical reason, then, you know, that's okay. It's not going to be for everybody. So I would just say do the best you can. When it comes to physical education, the biggest thing for me is keeping that 6 feet distance, so that way if someone who was at that physical education class got sick, you know, we'll have to talk to that teacher and say, do you know who that specific person was in 6 feet of when they were running around? And if not, then that whole class gets quarantined out of precaution. So if a teacher says, I don't know who was within 6 feet for 15 minutes, they were all running around, everybody was in contact with everybody, then that whole class becomes quarantined. So, again, the distance is super important. Masks are super important. They should be used together. One does not replace the other. They have different functions.
Good. That's probably the takeaway. They don't replace each other.
Yeah.
So the other question I had was, this one was a business where they have a couple employees who work every day. They have other employees who alternate different days, so like part-time workers. So their question really is, should they separate those two workers that work every day to protect their business from being fully shut down because of a quarantine issue? So in other words, you know, like the bubbles with the athletics that are happening with the sports teams, should businesses start thinking about bubbles?
Yeah, I definitely think it's a good idea to start thinking about, you know, where are people placed, who are the ones who are like, we need to be here. If people have a virtual option where one could be in the facility and one could be outside of the facility, and then that way if one person does get sick or has to be quarantined, it doesn't involve the other person, then that's an awesome option to go. Again, to keep infrastructure, to keep people there, that social distance is really what you need. The mask is not going to keep people off of quarantine. It's good because it could prevent the situation in which you need quarantine, but should a situation happen where there was a positive case, that being at least 6 feet, and I think what we're coming into is a lot of people are struggling with the idea of what actually is 6 feet apart. You know, some people will tell us, oh yeah, I was in this chair and they were in this chair in front of me 6 feet. But they don't think 6 feet to the side, like there was someone sitting right next to them. So it's got to be 6 feet all around. And I would definitely measure it because 6 feet is a little bit further than people think. So, you know, we find ourselves standing away from each other and talking, and then we'll be like, are we 6 feet apart? And we'll measure it out of curiosity, and we're like, no, we got a ways to go. So keeping 6 feet, even if you have both employees there the whole entire time, put them in separate areas, make sure they're 6 feet apart, and then that keeps your people there.
Okay. Well, I think you've done a good job with your presentation because we don't have any other questions. However, I'll ask one more to maybe close us off here. So if you had to leave businesses and those on the call with one recommendation as a follow-up to get more information, what would you tell them?
I would definitely tell them to communicate with their employees. I think that's the biggest thing. It's super helpful in preventing disgruntled employees. It's helpful in having people back you in the community in case there's a situation that comes. I get a lot of calls of places that say my employer just does not care about me as an employee. We've heard a lot of people who call us and say they've quit. So again, I just think the more communication that can be out there, the better. I would definitely communicate them with all those planning things. Here's what we're doing as a business to keep you safe. Here's what you can expect of us. But then also having the conversation with them too, as saying, as an employee of ours, please, when you leave this facility, because you're only here a certain portion of the day, please don't be going to large gatherings. Follow the recommendations. Wash your hands often. Avoid those risky situations. Wear a mask when you're out. Stay 6 feet away from others. Try to minimize your social circle to small groups of people, because again, they could be the ones that all the great work that businesses are doing to keep their employees safe, if they're going home and just caution to the wind, then they could be the ones bringing it in, and no matter the massive amount of work that you put into it, it's not going to matter. So again, letting people know that just because an employee tests positive with COVID does not mean they got it from work. And I feel bad for businesses who they get that rap that, oh, this workplace is a dirty place. They clearly didn't try to do anything. And it's almost not, it's unavoidable. And again, we're doing the best that we can do and have that conversation to make sure they understand, here's what we're doing, here's what you can do. Let's all be, again, I hate to say we're all in this together, but I mean, it's true.
Okay, we do have one question that came in. This one is, if a student tests positive, should the school reach out to the contact's family, or do we wait for the community, the county health department to reach out?
It kind of depends. So we've been working extensively with our schools, and I'm actually the school liaison. So we've been talking to our parochial privates, publics very extensively, and again, just like businesses will make their own plans, schools are going to use the base recommendations and make their own plans. So some schools might reach out to parents and let them know that, hey, we just found out that, Johnny is a close contact. We need you to come pick them up as soon as you can. The health department will be reaching out to you within the next 24 hours. Some schools, again, school might not even be in session. It could be a weekend, and then so it kind of depends on the school. And again, just like it's good to communicate with, employees, here's what we can expect. We've really tried to get the schools, especially in the recent weeks, to say, message your parents, message your staff, say, this is how we're going to communicate. This is when we're going to communicate. This is to who we're going to communicate. So everybody knows what to expect. If they're only going to tell the class that had a positive and not the whole district, then let people know that. So if parents are out in the community and they hear that there's a positive case over in this first grade class, they know, okay, the school said they would let me know if my child's involved. I don't need to worry about it. My kid's good. If you have not told them what to expect, they're going to hear that, call school, be like, what am I supposed to do? Is my kid involved? So again, letting people know what they can expect is so important. So sometimes it'll be the health department, sometimes it'll be the school, followed up by the health department.
Okay. More question that came in, so we'll keep going in a few minutes. So this one is really around all the sanitizing and disinfecting that we're doing. With all this happening, as we get into the sick season of the fall and the winter, what's happening to our immune system? Is our immune system going to be wiped out? Do we anticipate other problems?
I don't know. I mean, I don't know if I would not say our immune system is going to be wiped out. I mean, the younger kids, maybe wouldn't be exposed to as many things as they would if we weren't doing such, sanitization processes. But for older individuals, we've kind of already built our immune system. We've kind of already been exposed to things. We don't need to be re-exposed to them, every single season. We had that. We fought that, or, we have those antibodies. So I do think it's going to be interesting with flu and those other seasonal viruses that come in the fall and the winter that mimic very similar symptoms. It's going to be very hard, and that's something that we're kind of worried about of, how is it going to, look? Are there going to be a lot of people out that maybe don't have COVID and are out longer than they need to be? So that's why I think testing is going to be huge this fall, because it's better to eliminate the possibility that it's COVID and then know that it's something else, and that way we can get people back into school faster. Again, we're not planning on shutting down schools. If there's a case, it's going to be a case-by-case basis, looking at how it's spreading. And I think our schools have kind of expressed that they're worried that the thing that will close their doors and switch them to virtual is having not enough staff to actually teach the students. So again, there are so many factors that play into it, but I'm not too concerned about the sanitization practices. Is it going to affect the little ones maybe a little bit more than adults? Maybe.
Okay. Well, Lexi Otis, want to thank you for working with the Chamber of Manitowoc County and helping us educate on this, very important topic, very fluid topic. So
yeah, things could change. This is as of now.
Yeah. So your contact information is enclosed. This will also be available on Facebook Live as the recording ends, so people can go back and watch that and capture your information. So again, thank you very much, and thank you everybody for jumping on and listening to our webinar today.
Yes, thank you everyone.
Thank you.